Good evening, everyone. I am Dr. Nandan Marathe from Mumbai, and today we'll be discussing metastatic spine tumors and algorithmic approach. So, metastatic spine tumors are much more common than primary spine tumors, and almost 20% of them are symptomatic. If we look at the current indications, like why do we operate in spine meds, these indications can be summarized briefly as to establish the diagnosis, management of tumor pain, neurodeficits, instability, and to improve quality of life. So have these indications changed? What has changed? In terms of indications, they remain more or less the same, except for maybe surgery is now also an adjunct to radiotherapy. However, when it comes to expertise and approach to spine meds, these have drastically changed. So that is what we'll be mainly covering, that is the current updates in expertise and approach to spine tumors. And to cover these changes, we have a wide array of panelists world over, including Dr. Dan Scuba from New York, Dr. Suratwala from New York, Dr. Eric Massicot from Toronto, and from India we have Dr. Priyank Patel and Dr. Ajay Krishnan. So we'll directly step into the topic, and Dr. Priyank Patel will introduce and take it over from here. Thank you.